What what is going on, everybody? Welcome to the Patching Practitioners podcast. And I'm bringing people in, so let me get okay, good. Joining. Good. Zoom is great, but Zoom needs to speed things up a little bit. But anyhow, welcome to the Patching Practitioners podcast. It's the third week, the third Thursday of the month. And I am Dr. Tim of the tag team. I am a doctor of chiropractic and been using the patch technology now little over 2 years, and with great results in the office and great results with my own health. And we also have today we have Dr. Jay Reister and Dr. Don Warren, and I guess we should call ourselves the Chiro 3 or something like that, because all three of us are chiropractors. We got to come up with something. And Dr. Stan is on business, and him and Jody are on business because you know what they're doing? They're sharing the patch technology that we're going to talk about today. So if I keep looking back and forth, folks, don't let that distract you. I'm admitting people as I'm talking here. But at the same time, we are doctors of chiropractic. We are not medical doctors. We have nothing to do with allopathy. So we are not here to diagnose, treat, or to give any medical advice. We are here to talk about supporting and healing and how to optimize health. I don't know how else I could say it. We're going to talk about a few things here. All three of us we do live patch parties, big events. A lot of people show up. And one of the biggest questions is, where do I start? And we're also going to talk briefly about X49. I'm starting to get known as the X49. I'm known as the X49 guy. I love X49. But if you're new to this, and we keep talking about patches, well, what is the patch? This is what I'm talking about here. This is the patch technology that we're going to be addressing. And this is like a waterproof Band-Aid. It's smooth on one side, and then it's sticky on the other. And what you do is you take the paper off, and then you stick it to your body. And what this patch technology does, you can kind of see in the middle, there's like a circle within a circle. That is the technology. And what it does is when you apply this to your body, it takes the infrared light from your own body and it reflects it back into the body. And it results in a physiological response. It activates cells. It stimulates peptides. It does a variety of things. It helps accommodate the inflammatory process. There's several different patches, and each one is blended at its own frequency, own wavelength. And what it is, that circle within the circle, that's a crystal lattice, and that crystal lattice is made from organic amino acids, sugars, salts, and stabilized oxygen. So the founder of the company is David Schmidt, and the inventor of these patches. And he's found a way to take those materials and blend it together into a crystal lattice. So what happens is that infrared light from your body that we cannot see, but you can see it with specialized optics, reflects off that at a certain wavelength, and it bounces back into the body and does a variety of positive optimizing health benefits. And so we're going to start off with where do I start? And then again, we're going to address X49 a little bit. And we're going to hand this over to Dr. J. Dr. J, can you give us some of your amazing wisdom?
Thanks, Dr. Tim. I appreciate you guys and being in this wonderful world of stem cell activating technology with you. Yeah, I've been patching. I'm Dr. Jay Reister from Kent City, Michigan, which is north of Grand Rapids. I'm in my 25th year of being a chiropractor, and since 2012, had my own shop. I've seen a lot of things over the past 25 years in the health world. I haven't seen anything quite like this. And it's just an amazing technology. It's non-transdermal, as Dr. Tim said. So that really intrigued me right off the bat, when we're not using any toxins or pharmaceuticals or any meds, any drugs. So long short, when we're starting a patient or a loved one on these patches, what I do first is I talk to them about health habits, which we all know a little bit, and drinking water is probably the most important one of those, because when we're healing on a cellular level, your cells are 60 to 70% water as their substance. So to hydrate frequently. Most people know that 1/2 of your body weight in ounces is the golden rule. And people will be like, oh yeah, twice a day I just go. Yeah, that's not the best way to do it. If you do 3 to 4 ounces every half hour, that is a really good way to get your body to absorb that water instead of guzzling it 2 or 3 times a day in mass quantities. So drinking water, hydrating, staying hydrated is super important. Add some Celtic sea salt to your water, shake it up and just drink it, or you can put the sea salt on your tongue and before you drink the water. Either way works. But staying hydrated is super important. So for the first month, when I've got somebody with, even with significant conditions, and they want to use 4, 5, 6, 7 different patches, I always start them on 2. Okay, we'll get into more. We do. We want to definitely make a specific protocol for each individual person, and everybody's different. But to start, for the first 1 full month, and I don't know if you guys do it the same way I do, but for the first 1 month, I just keep it simple. Learn to patch by doing just a dynamic duo. You've got the X39 for stem cell activation. You've got the Eon for inflammation reduction. As you increase your stem cell activity, you want to get that inflammation out of the way. Otherwise, you're going to waste some of your stem cells on inflammation, and I don't want my stem cells wasted on nothing burger inflammation. I want them going to something vital. I want them going to something crucial. I want them making a difference, not just being wasted on inflammation. So for the first month, we do the dynamic duo again, which is the X39 and the Eon. And also get in the habit of drinking an adequate amount of water. Most people out there don't drink enough water. I'd say 90% or more of the US population do not drink enough water. There's a few people that I have talked about this with, and they are on point. They're doing what they're supposed to do as far as hydration. But even if you're good at it, these patches will make your body crave more water because of what your body is made out of, what your cells are made out of. A lot of it is water. So I do, for 1 full month, the X39 and the Eon, and also to create that new habit. Our lifestyles, changing lifestyle habits are difficult. Adding ones are easier than subtracting, to be honest with you. So I use the first month as kind of a trial basis. Get used to this, get used to this, and get used to this. The first this is staying hydrated. The second this is putting your patches on. The third this is taking your patches off 12 hours later. Everybody's schedule is different. I have found what works really good for me is to put them on late in the morning. Okay. I'm a 10 o'clock to 10 a.m. to 10 p.m. guy, because when I take my patches off, I don't just throw them away. I put them on my children, my special needs daughters, my youngest, myself, my wife, and Jacoby get fresh ones right out of the sleeve, right out of the envelope. But my bigger kids, they get our used ones. And my middle kid, my daughter, she does not like the thought of me taking the patch off myself and then putting it onto her, because she thinks of it, she talks about it like it's a used Band-Aid. And honestly, I can't disagree. So it's easiest for me, you guys might take this tip, it's easiest for me to put my used ones on my 11-year-old daughter when she's sleeping. So I sneak in and I put them all in. I put them all in, like there's 4 or 5 or 6 of them, depending on the day. And I pinch them all together, like I form a little flower with them. And then I sneak into a room, I pull back her underwear and I stick it on her hip. And then she wakes up the next morning and takes it off and probably gives me a grimace with me not in the room. But it always has worked best for me to just do that while she's sleeping, so I don't have to put up with her fighting me when I'm trying to help her be healthier. So after the first month, that's when we start getting into more specific goals. Like one of the first additions is glutathione, carnosine, Elevata. I don't know. It totally depends on the person. Tim's going to say X49, and I can't disagree with that either. It totally depends on your lifestyle, your goals, um, what your health situation is. I mean, your goals could be lofty, but you could have a body that's beaten down. So the more toxins in your life or your history, depending on your age. I grew up on a farm and we had glyphosate everywhere. So I used that glutathione a lot because it's a detoxer. Um, Carnosine for heart and brain memory. That's what my daughter's on. My special needs daughter is on carnosine, Eon, and 39 mostly. A couple other ones every once in a while, but those are her three primary. Everybody, it is case specific. There's 10 different patches. Some of you that have been patching for a while probably know that there's 10 different ones. There's two that I've actually never purchased. Um, the silent nights, I sleep like a baby, and I've even slept better with just the dynamic duo. Um, that one I've never purchased, but the other ones I have in my closet, and I actually keep a set of them in the kitchen because I don't want my wife. We put them on the island there in the kitchen, and I don't want my wife to forget her patches, so I put them out in the open so she'll see them and do them. But I'm very curious on if you guys have a similar beginning plan that I do, 1 month of the dynamic duo, and then kind of add as you see needed based on the patient. So I'm gonna go ahead and pass it over to Dr. Don, and hope we have a little bit of time at the end for a little bit more discussion on that.
Hi, I'm Dr. Don Warren, and I've been practicing for about 35 years, since 1990, and have a couple docs in my clinic, and we do a wide spectrum of things, including light technology. We've been into laser therapy. That's what initially intrigued me when I heard these patches were a light technology that would reflect the light back into you. And I started listening with big ears once I figured out how it works and the wonderful technology behind these things. And one way I explain, if people are looking for a way to explain, like, how does this little patch do anything? And I happen to be wearing one called Energy Enhancer. I've got the white on the right, and I've got another one on my left. But the Energy Enhancer helps to boost energy. It was the original patch made for Navy SEALs, which is pretty cool to let people know this technology was around for initially Navy SEALs. And it's great that we're able to use it every day in practice. But when we're focusing like we are today on the dynamic duo or trio, maybe a little bit, I think one of the other docs has talked about X49 too. But the X39 is wonderful for boosting those stem cells, activating our cells, increasing energy. I can tell every time I get those on, if I forget and I get to lunch, I'm like, oh, I'm not feeling the same like energy I normally have when I have them on when I wake up. And my usual routine is I put them on at 7 a.m. And I always do X39 and Eon. I'll add carnosine and glutathione just to help increase circulation of the heart and the brain. And as Jay was saying, Dr. Jay, the glutathione is great for detoxing. We live in a very toxic world, so I've used that. But as far as the X39 and the Eon, I have seen with my patients, I'll usually start them for a month or two on just those two. And probably the first 2 months, I'll set them up with a package that covers them for 2 months. Um, Either the core package. Some patients want to just start out with the advanced, and that's fine. Then they're on them for 4 months. but we know it's best, to use these a month for every decade. And I wouldn't undersell a person by trying to do a little bit and a little bit and a little bit. Most people, when they can afford an Apple Watch at $800 or drive the car they're driving, or the iPhone at $1,700, this is going to change, can really change people's lives. We've seen miracles with our patients, wounds heal on diabetic patients, all kinds of wonderful things. But the Eon patch is great for decreasing inflammation, decreasing anxiety and tension. And so in this world, we've got so much going on in politics and world stuff that it can be a little tense for most people. And to have the X39 boosting your stem cells, the Eon lowering your anxiety, lowering your inflammation, can really help a person sleep better in the evenings and have more energy through the day. And they just help the overall. One thing that Dr. J mentioned is salt too. These are my two top choices. I'm not sure if you can read that in the light, but one is LMNT nutrition, and it has a lot of sodium, potassium, magnesium that help the patches to work. You want to stay hydrated. The other product I prefer is this Baja Gold Sea Salt. There are several brands. There's Redmond, there's Celtic. Baja has been shown to be one of the highest in multiple mineral content. And I actually taste tested 3 of them about a week ago, and you can just taste the difference in that Baja Gold. It'll boost the mineral content, help the patches to work better. One other trick I use, and I am starting to teach my patients to get some of these. You can buy these little canisters online. I don't know if you can see that. They're little metal canisters, and it protects those patches, because the cells, these patches can be activated with heat. And so you don't want to walk around town carrying them in your pocket, hoping to show somebody how to use them and accidentally activate them. So I've gotten to a place where I'll put the patches in these little canisters to help protect them. And then I can carry them around a little easier without any worries. Infrared cannot activate them that way. And that was one little trick I've done. But we do start out most of our patients for the first 2 months, I would say, on the X39 and Eon, because sometimes they'll detox. And if they are starting out with glutathione and carnosine and all these other patches, they might feel like they're almost sick with the flu because they're detoxing too quick. And so once a person gets to that place where they're staying hydrated, they're detoxing, month 3, 4, we'll start adding in other patches and talk about those things. And at this point, I think I'll pass it on to Dr. Tim.
All right. Thank you, Dr. Don and Dr. J. And folks, if you have any questions, put them in the chat, and we're going to address those at the end of the presentation podcast. But yeah, you know what's nice about these patches, folks, is it's reproducible results. And again, it's not diagnosing, it's not curing, it's optimizing and supporting health. Because, when you get the peptides going and you have those dormant regenerative cells woken up, and they're going throughout your body wherever there's an inflammatory process, and they're healing that tissue. But clinically in my office and just talking with people, X39 and Eon is a great place to start. Now, there's some people, it might be a financial component, and depending, like if they have a lot of like pain and inflammation, sometimes I'll just patch them with Eon, but they'll eventually get X39. But if someone doesn't have a lot of inflammation, then we'll start them on the X39. But my rule of thumb, when you begin patching, to begin with X39 and Eon, because like what the previous doc says, there's 3 primary things. It activates those dormant cells. because as we get older, those regenerative cells, they start to go to sleep. And when you get that reactivation of that. And then with the Eon, it accommodates that inflammatory process. You want to get all that gunk out of your body because our bodies, we're taking in insecticides and pesticides and herbicides and glyphosate and genetically modified food. And it's our bodies are just full of inflammation. So it helps that. But another thing it does, those two patches together, they auto regulate the autonomic nervous system. And this is something that it's kind of confusing at first, but once you learn how it works, it's kind of like a thermostat. On one end of the spectrum, you have the fight or flight. And then on the opposite end, you have the healing and the reproduction and the sleep. Well, most people are stuck in that fight or flight because of all the inflammation and all the toxins and all the garbage in their body. So you want to get that autonomic nervous system re-auto regulated. So when you go to bed at night, it auto regulates down into that healing and sleeping mode. But there's another component is the X49. I love X49. X49 is the one thing that really changed my life because weight training, which I do often, I don't get sore anymore. I have bigger gains. When I say bigger gains, my muscles are more full. My cognition is better because what X49 does, it stimulates the daughter peptide, the AHKCU. I didn't really get into the X39, but it stimulates a peptide that there's a layer of cells in our cardiovascular system, and it stimulates that, and it helps blood flow. It helps blood flow into the brain and blood flow into the muscle, and it supports that inside endothelial cell tissue. And that's where nitric oxide is also produced. So you're getting these benefits of nitric oxide. So when I get an athlete or somebody that weight trains or someone that leads an active lifestyle, I recommend starting with X39 Eon and X49. And then later on, you can integrate the other patches. And it's nice because these patches, they come in these nice sleeves here. There's 30 patches per sleeve. And like Dr. J said, you wear them 12 hours on, 12 hours off. And there's a question here about Eon too. Where would you patch Eon? And with Eon, that's the inflammatory accommodation patch. You can put it behind your neck. You can put it below your belly button. Personally, I wear Eon below my belly button and with great results. But here we go. Clinically, in the office with Eon, we have patients with like points of discomfort or points of pain, and we've placed Eon right on areas of pain or discomfort I think with a little bit better results than just sticking it on the back of your neck or under your belly button. So those are the three I recommend. Again, if you're starting out, X39 and Eon. If you're starting out and you're an athlete or you weight train or lead an active lifestyle, you want to do X39 Eon and X49. I love those three. All right, guys. Do you guys want to go through some of these questions here?
I've been answering some of them, just typing in.
Oh, okay.
But
Yep.
I had a question on those containers. I'm not sure if anybody can see me, but they're little round aluminum containers. They look to be about 1.5 to 2 inches. I got mine on Amazon. They came in a pack of like 24. And then Jen Sullivan on patchedu.com has stickers that you can put on these little containers so that you can keep track of what's in each of the containers. And then I've added a link to the Element product that I'll use sometimes in my water bottle. And then otherwise, it was Baja Gold Sea Salt is one of those that's rated the highest in mineral content.
Yeah, you can pretty much like Google that, even like Amazon. You can get a lot of these products.
Yeah.
Where's the best location for the Eon patch and 12 hours on during the day? Yes, 12 hours on. Best location, like I said, I wear mine under the belly button or behind the neck. If there is a point of pain, you can try patching it right there. And Eon, you can wear day or night. I've had some patients where they like wearing it at night, and some they get better results in the day, but it's day or night.
I want to
Okay,
make a
bye.
comment on.
Yep.
I just saw somebody comment, a young lady, that she's been patching for quite a while and she hasn't seen physical results yet. I will tell her to stay positive. I've changed. I know what we've heard from our upline or the people that have been doing this longer, that David Schmidt designed these for 1 month for every decade of life. But I'm in the under promise and over deliver business, and I have been for a long time. So I tell my patients, if you're two things, if you're 20 to 40 years old, or you're 8, 10, 15-year old with significant issues, you're going to want to patch. You're going to want to give this 6 months. If you're 41 to 65, you're going to want to give it 9 months. If you're 80 years old, you're going to want to give it a year. And if you're 100 years old, you're probably going to want to give it a year and a half, because there's a lot of miles on that frame. There's a lot of damage that's been done and then covered up by decades of life. So I kind of switched my rule up for my patients to, like I said, 20 to 40 years old, you're going to want to give it at least 6 months. 41 to 65, at least 9 months, and 80 years old, a year, and 100 years old, a year and a half. I had so many people that were close to my age. I'm 53. I've had so many people in the last 2 years, like following that month for every decade. Some of them gave up. I had a girl that I've known since she was 4 years old. It breaks my heart. We were in nursery school at church together, and she's got some significant issues. And she, after about 4 or 5 months of patching, she gave up. In my opinion, she should have done 9 months. And because I know what I've seen with these patches, some people unfortunately take a long time to respond. I've seen that. I have also seen the one patch wonders. So there's no doubt in my mind that everybody that stays consistent, I don't want you, drinking and smoking 4 or 5 days a week and expecting these patches to work their miracles with you doing other toxic habits. But if you're setting your body up for success in other areas, like staying hydrated, eating some good whole food, staying active, exercising, sweating a couple times a week at the very least, your body will make some very, very amazing positive changes. And we're healing on a cellular level, so it takes time. My heart is broken for my friend Annette, who did quit about 4 months ago. She gave it up, said she wasn't feeling anything. But the patches, they're not on trial. They've gone through so many clinical studies proving the patches do what they are say they're going to do. Photobiomodulation, it's a well understood science. It's the first company that's using it in this manner. Wearable light therapy, it's amazing. It's next level technology that we get to put on our bodies. I mentioned this in other meetings before, and Dr. Tim mentioned it again. This was made for the Navy SEALs. Okay, this is high tech, wonderful stuff, and it's not priced out of our reach. I mean, there's usually technologies like this. Hollywood gets the celebrities, the mega millionaires, things like that. This is a technology that you don't have to be wealthy to take advantage of. So with all that being said, I saw the comment. I didn't see who it was. I just tried it. I just wanted to say this to encourage you. With that being said, just stay positive, and stay patching, stay consistent.
Yeah. Yep.
That's about it.
I saw one other question, Jay, where one of the people have used them for, I think she said 11 months, and she's had back pain or sciatica. What I have said in the seminars, in fact, we just did one 2 days ago with 20 or 30 people with Dr. Don Verhulst. He came down here and put on a seminar. with Valerie and myself. But we talked about, like, if you got bone on bone knees, the patches aren't going to make it grow back cartilage, and it's not going to take away all the pain of a terrible, a issue that is needing a knee replacement. And if there's a disc that's bulging on a nerve, this might help reduce some of that, help the healing. But in the end, people may still need that, just surgery to get rid of a herniated disc. And so, again, we're not diagnosing, treating any one condition, but if people are looking for it to help this one specific, problem that is a bulging or herniated disc or something else, it may not fully fix that zeroed in thing. But time. I know Dr. Verhal said, I think it was a year of being on patches for him, that suddenly he no longer suffered from major depression. He would go through depressive episodes, even though we all see him as a positive, outgoing guy. He struggled with depression. And he said, but now he just has not dealt with his seasonal depression that he would have a big struggle with. So
Yeah.
Continue on these. You may not feel it, but again, Jay, you said it well. These are working. They're not on trial, and they do work.
Another thing that our friend Dr. Don Verholst has always mentioned, that it's smart technology. Your stem cells know your body.
Hi, this is Bernie. Oh,
What
I
your
see that you're on
diagnosis is. Can you guys hear me?
Yep, we got you.
Okay. So your stem cells know your body, care what diagnosis you have. Your stem cells are going to go to your vital organs first. Our nervous system is 9% sensory, 91% instructions. We don't get to feel the instructions. We don't have to feel the instructions. With that being said, on average, people have 91% more problems than they know about. Okay, just neurologically, how the nervous system is set up. So you might have liver, you might have heart, you might have lung issues that you are not aware of, that these stem cells are going to first, because they're more vital than a knee or a shoulder. So with all that, just stay positive, stay patching, because your stem cells are probably doing something more important to your survival than what you really started the patches for in the first place.
Docs, do you have a few extra minutes to go over today?
Yeah, I do.
Okay.
And I saw that one comment about blood work, and there have been multiple people that have seen their blood work improve. I've had patients that have seen that already myself. And so I'm about ready to redo mine just to check my own personal one.
Yeah, and price wise, X39 and Eon, it's pretty much the cost of a cup of coffee per day. So this technology is an affordable technology. And folks, you got to keep in mind too, that the healing cycle of the human body is like 6 to 9 months. So when we start supporting the body, we need to give it time to heal. I have patients and people that we recommend the patches to, and a lot of times within a couple of weeks, they're sleeping better or they have more energy. But there is some people, they have more chronic type conditions. But when you patch yourself with X39, regardless of what you think, regardless of what you feel it is activating those dormant regenerative cells, and they're going throughout your body and they're healing the tissue. The Eon is accommodating that inflammatory process, and you just got to give it time, because we've been living in this society where it's like, I need to take this because it's going to make me feel better. And it's like, yes, but this is not allopathic. This is a supporting type of technology. And when you stick with it, it will help. And, again, like the docs say, it's, we need to stay hydrated. We need to drink water. But another recommendation that I provide my patients is we need to, intermittent fasting is good. Like 1 to 3 times a week. Don't eat for like 16 hours out of one day, and give your body a chance. Because as your body is being healed, as it's being supported with the patch technology, you're going to give your organs and your glands and your cells and tissues a break, and it's going to benefit and speed up that healing process. But yes, add the Eon with you've been patching with just 39 6 months. Yeah, add that Eon, because you're having that you have that those cells being regenerated, but you need to get rid of the gunk, the effects of the healing, which is inflammation. So that Eon will help accommodate that inflammatory process. Okay, let me let's see, go in. Okay, there you got there. Yes, Eon 2 finger, what's below the belly button? Yes. Um, is X49 helpful for stroke and or dementia? Again, we're not here to diagnose, we're not here to treat, we're not here to give any medical advice, but most of the time that is coming from here, and X49 will help open up that that cardiovascular system so that cognition will benefit. And there is some testimonies on that. Um, it's on Telegram.
Evolve.
What is it?
Evolve Stories.
Yep, Evolve Stories Telegram,
Yep.
and that'll show you some of the testimonies. But yes, it's cardiovascular system support, it's endothelial tissue support, and that's what these patches do.
And I like that you're talking about diet, because even with a lot of my low back or neck or any of my patients, I recommend get on kind of an autoimmune, anti-inflammatory type of diet. I personally have used paleo most of the time, which cuts out grains, which cuts out dairy, and that's hard for some people to imagine. But when you cut those things out, you take away inflammatory processes in your body that can be really hampering the healing process. Um, and the more we cut out anything that's refined or boxed or processed, you're gonna feel better. We want to eat from the farm, not the factory. And so I tell my patients, shop the outside of the grocery store, get the freshest meats, get the freshest vegetables, try to eat organic, non-GMO, and that will help in the process of all this as well.
Exactly. I mean, it's like we can patch all day, but if we're not hydrating and not eating good food, putting good stuff into our body, we're going to benefit a little bit, but you need the replacement parts. So there's another question. Can I let's see here. Can I replace X39 with X49? Yes, give it a shot. Like I said, with some patients, we'll patch them with Eon only, or X39 only, or X49 only. So yeah, you can try the X49. Now, folks, we only got a few minutes left. I'm going to try to get through these questions the best I can. Will the Celergize be enough instead of taking sea salt? Docs, you got a comment on that? I am not sure. I would still recommend the sea salt on top of that.
I would recommend the sea salt just for hydration. I mean,
Yeah.
I do the Celergize every day to make sure I also have the copper, which may not be in the sea salt, all those other things. But David Schmidt has put everything you need for the daytime patches in that Celergize. So I do use that daily. And then otherwise, it's just a great idea to be hydrated. And to buy a pound bag of Baja Gold sea salt, it's going to last you months and months. Um, and so I would advise both.
Okay. Now another question: if it doesn't help bone on bone knee, then why aren't the doctors recommending stem cell ejections? Well, again, we are doctors of chiropractic, and that's kind of out of our practice.
Right.
That's something that you got to choose yourself. But again, when you have those regenerative cells going throughout the body, just see what happens. And
And ice wave might be something that helps a person
right.
like that. Or with the back pain case, you put the brown patch on the area of pain, and then you clockwise put the white one. You find a place that tends to reduce that pain the most. But we have found great results with the ice wave patches for immediate pain relief. And that would be one other, patch to try.
I gotta go here pretty quick, but I personally have a patient on this cartilage conversation. I personally have a patient who has had a 20-year ago wrist injury. I've been treating him for 7 years, his neck and low back. He's a mechanic. And after about 5 months on the patches, he said his wrist joint grew back. He couldn't flex, he couldn't extend, he couldn't twist a screwdriver.
Wow.
but after about 5 months, now 20 years ago, they wanted to put a metal plate in it. He broke it in enough places to where it wasn't very stable, but he just had him cut the nerve so he wouldn't feel the pain, and let it heal how it was going to heal on its own. And after 5 months of patching, he could bend and flex, and that was a 20-year-old wrist injury. So I'm not going to put limits on our God or the technology that
Yeah,
that we,
correct.
you know what I mean? So I don't know. It depends on the pain level, how long you can wait before doing something like before this technology. I would have said yes, definitely surgery, but now I don't even know anymore. I mean, I've seen some crazy things.
Yeah, yeah. And you
But
don't
I
always
gotta
have
go
to
too.
put Eon under the belly button. You can put Eon directly on the area of pain.
Absolutely.
My wrist was bothering me because of all the adjusting I've done for 35 years. And so I put Eon right by my wrist, and within minutes, my pain level reduced. So that would be another idea. Or for the young lady that was talking about her back pain, put it right on the back. But again, we can't directly advise about healthcare conditions. We're docs, but we're not your docs. So.
Yep. And one more question here. Where is the correct place to apply the X39 and the Eon? X39 is really good behind the neck, and you can place Eon below the belly button. That's my recommendations with patients, and it works very well. Anyone know the Telegram channel? Put Evolve Stories in there, and it's not there. It's funny. It's kind of hard to find sometimes. Type in like Evolve Stories, Evolve Testimonies, and you will come across it. So, and what Dr. Stan's it's Life Wave Living with Dr. Stan. I think there's if you go to if you search under there, I think you can find a link or somewhere to find that. Yeah, the Telegram sh- uh yeah,
Telegram's not easy to use, so I don't use it very often.
yeah, I don't me neither. I don't really go there that much, but
And one of my favorite websites to send people to is startx39now.com. And it has the testimonies, it has information, the videos,
Yes.
several things.
StartX39now.com is a great website.
Yep. And they just revised that website too. It's even better than it was before. Well, folks, we went about 15 minutes over. We got to get back to our office, and
Go.
hoping you guys enjoyed this. Thank you, Dr. J. Thank you, Dr. Don. If you're interested in becoming a brand partner and ordering patches, make sure you go to the person that invited you or that told you about this wonderful technology. And folks, you know what? Just have a wonderful week. Patch up. It's still summer, so get out and enjoy summer. And just, yeah, you know, and if you're a brand partner, this is a wonderful way to make extra income. Actually, I know a lot of people, they're making substantial income. And like with me and Dr. Don and Dr. J, we use this in our office clinically. And you do not need to have all the alphabet soup behind your name. You can share this with people and get the same results that we get into our office. And when you start offering this technology and people start healing because people need this technology, yes, finance, money, or what's a better word? Wealth. Basically, you'll get paid for sharing this technology and helping people, and you deserve every cent of that. All right, folks, I'm going to stop this recording. Everybody have a wonderful week, and we will talk here in a couple of weeks.
God bless.
All right, take care. Bye.